Welcome everybody to our next Deeper Than the Headlines video. In this video, we have a case that highlights the importance of accurate medical coding, both procedure codes as well as diagnosis codes. So this case involves an OB/GYN in the Chicago area. She was recently sentenced to 10 years in prison and was ordered to pay $1.5 million in restitution. Some of the codes that were inaccurate were procedure codes, CPT or HCPCS codes, and they included the reporting of higher level E&M codes or evaluation and management codes than was actually supported in the medical documentation. And specifically, the codes in question were 99213, 99214, and 99215. So those are 3, 4, and 5. Those are the levels 3, 4, and 5 for the established patient office visit codes. And she billed these for both in-person office visits as well as telehealth visits when their level of service was not actually provided. Other procedure codes that were billed and were reimbursed were endometrial ablation and endometrial biopsy procedures. And the reason these were a problem was because they were coded with false diagnosis codes. So, and that was done so that those procedures would be paid. Obviously, those procedures should only be done for certain conditions. And if the patient didn't actually have those conditions, she would report a diagnosis code that wasn't truly what the patient had, but that diagnosis code would get the claim reimbursed. So just a couple examples of the importance of accurate medical coding. And of course, compliance programs and auditors, right, should have a plan in place to regularly monitor and audit the medical coding found in bills and claims, and those codes need to be supported by what's in the medical record. And of course, the medical record needs to be true and accurate. So there's a lot there to be auditing and monitoring on a regular basis. Thanks for listening.